Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. We got a good show for you today. First off, Bynes Eyelid plastic surgery. We're going to talk about that. Next, a new study came out that showed how much Americans' health worsened after the pandemic. But in our last segment, Sarah's going to tell us what's better for losing weight, incline walking or running. All that's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It really does help us. And please leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is the wonderful Sarah in a very fetching outfit, I must say. I do like it. It looks very good.
Yeah, we were talking about my print.
Houndstooth. Yeah. No, that's really good. Travis, in the box, you got a houndstooth jacket on in there?
I do not. I have some regular like 90 stripes. I guess you
I do like 90 stripes though. It looks sharp,
That's
man.
about it.
Yeah, very
and
good.
my helper in the back.
I see you got a helper back there. The intern today?
Yeah, taking the TikToks.
All right, nice. Well, everybody having a good week? Anything exciting happening?
I'm taking Avery to two things this weekend.
Tell me.
So today I'm going to take her to the Harry Potter experience in Little Elm.
Is she a big Harry Potter fan?
I don't know, but I am.
Oh.
So
so you're going to go do something.
She's watched like the first two movies, which are the most appropriate for her age.
Right. Yeah.
Because after that, it starts getting
dark.
it gets dark and it's just, they're long.
Yeah.
Yeah. So she liked the first movie for sure.
Oh, then she'll love
So
it.
yeah, she
That'll be
likes
fun.
all that
and
stuff.
That's around here somewhere?
It's in Little Elm.
Oh,
so
Little Elm.
around
Nice.
Louisville.
Cool. I
And then and then on Saturday I'm taking her and my mom to go see the Nutcracker in Dallas.
Oh, fun. That'll be cool.
Yeah.
Awesome. Wow, you got a big weekend.
I love going to see the Nutcracker. I was in the Nutcracker when I was in college.
Oh, were you in?
I was an acrobat.
Were you?
Yeah, I
Wow.
dressed up like a Russian man.
Oh my
I had
gosh.
a beard and a hat,
can't
and
see
I
you
would
with
just
a
sit.
beard.
I was literally the whole time doing back handsprings and straddle jumps for like 2 minutes. It like I don't know how I did it. I was in such better shape.
Wow.
Thinking about
Yeah.
doing that now, I'd vomit.
You had the strongest arms in like 4th grade.
Yeah.
The strongest 4th grader out there.
I was not in 4th grade. I was in college,
Oh, never mind. I thought this was like school.
and I got paid
You got
wow.
paid to do it?
$100 a show. It was a professional
Wow.
They flew in.
You're like a professional thespian.
I know they flew in Russian ballerinas and everything.
Jeez, wow.
It was serious.
In college, $100 go a long way.
Yeah,
Yeah,
it sure
I was
does.
like, I am buying so
You're
much
like,
stuff.
I'm rich.
I know, it's on me.
Awesome. Well, I'm gonna have to get a full report on those things.
Yeah,
That sounds like
it's
a
gonna be
pretty,
fun.
pretty big weekend.
Yeah.
So
What about
I
you?
did the marathon thing last weekend.
Yeah, you did. I saw it.
It did good. Like, I was really happy. I was a little nervous because I had to run like an 8-mile segment.
Yeah.
And I'd only been training at 4 miles. I was hoping to get like 9 minutes per mile because I've been running like 8 minutes per mile roughly with 4 miles.
Mm-hmm.
So I was like, oh, if I double that, maybe if I slow down to 9. But I actually ran 8:27 per mile.
Oh, at what lap or what mile were you like, oh my gosh, I gotta slow down?
I was actually running closer to 8 minutes per mile up until the 7th mile.
Okay.
And then two things happened. One, like my body's like, what are you doing? Like, this is not how far we run. And then two, we hit this big hill. And so the last mile killed me. But I'd done so good in the first 7 that my time still was pretty good. Like, I mean, I was kind of hoping I might get below 8:30, and so I got 8:27, which is below it. And I was like, yeah, nice.
I would have been solid 10 to 11 minute mile if I was running.
My team did like right at 10 minutes per mile. Like all of them were kind of right about the same. But yeah, I was really happy with that. It's fun. I used to do a lot of races like that, like 5K, 10Ks, half marathons. And you just kind of get out of it, you get busy and stuff. And I think I'm gonna get back into it because I really enjoyed the competitiveness. You know, because I mean, you're running against a million people, but like, you know, trying to get ahead of the next person and not let somebody. I just kind of enjoy that being a runner. So
I think Denton has a lot of little running things.
I think I'm going to sign up for something in the spring because that'll keep me going.
A goal, yeah.
Yeah, if I have something I'm, you know, trying to train for, I'm pretty consistent about getting out there. So
yeah.
Where was the course like?
So it started right at downtown, like in Main Street, Dallas, and then it went out to White Rock Lake and around the lake and came back. And so I had my run. I started at White Rock Lake and then ran all the way back to downtown.
Nice. Wow.
Yeah.
That's a good distance too.
Yeah, it was a while. But no, it was fun. And like, you know, it's kind of cool because they have like DJs like every half mile, like spinning tracks. And there's people, I don't know where these people come from. There's people out, I guess their family members are running or something. My wife is like, you know, I'm not coming out there, right? I'm like, no, I don't expect you to come out and like cheer at the finish line or anything. But no, it was good. I was really, really happy. And, but I was like sore all week because, you know, I ran much harder than I normally do.
Yeah, I would have been super sore.
Yeah, like I just like even today, like when I was like bending out to get some, I was like, oh, yep, still a bit sore. I haven't run since then, but I'm gonna get back into it this weekend. But so anyway, yeah, that was cool. Like, so I was pretty
the
happy.
last segment, I'll have some tips for you.
Yeah, I'm interested to hear. You know, now that I'm kind of back into the running thing. So, all right, well, let's jump into some segments. I know you've already heard about this story.
Yeah.
So Amanda Bynes was
Poor
on
girl.
social media this week talking about having plastic surgery. And she was actually talking about having a blepharoplasty, which is eyelid surgery. And so she did a little video, which, you know, I thought we'd play it because I'm always interested to hear, you know, what people think about plastic surgery.
But the video is kind of funny to watch because she sounds so like monotoned and
She does, right? Yeah, I would agree with that. So,
and like I don't know, it's just kind of silly.
It's a little off. But anyway, all right, Travis, roll that video, will you?
So I saw a couple of stories online that say I have a new look, and I was never open about this before, but I actually had blepharoplasty surgery on the skin folds in the corners of my eyes. So I don't have those skin folds anymore. It was one of the best things I could have ever done for my self-confidence, and it made me feel a lot better in my skin. So I just wanted to post about that just to clear up that rumor. As to why I have a new look. I feel a lot better now about myself, and I'm so glad I had the blepharoplasty surgery. It was one of the greatest things I could have ever done.
Alrighty, so a little bit to unpack there. Those eyebrows are really blue. That kind of was distracting me a little bit. But no, she seems
is a
like
distracting gal.
Yeah, she seems like she's really, really happy with her surgery, which is great. It was a great experience for her, and I mean, I'll kind of go into her results in a minute, but yeah, so when I saw this story hit, I was like, wait, I think she's really young, and so she's 37.
Yeah, she's my age, or around my age. Like, I remember watching her grow up as I was growing up.
Yeah, she was a child actor, yeah.
Yeah.
So the first thing I thought is, wow, she's really young to get a blepharoplasty. And then I thought, well, did she even really need it? Because I mean,
it's just it just makes her eyelids look like more space, I guess. Like opens her eyes
it was
up.
actually her bottom ones. So I actually went back like through the last decade and got some pictures of her for before, because I wanted to see, you know, because that's obviously after. I wanted to see the before and did she really need it. So Travis, throw up that next picture, will you? So this is all her, obviously, in different times throughout the last decade, and you can see that her lower eyelids do have quite a bit of wrinkling in almost every single picture, which for someone in her age bracket, which in these pictures she's anywhere from like late 20s to early 30s, it's pretty unusual to have that much redundancy of lower eyelid skin. I mean, it almost stands out a little bit. I saw the picture, I was like, oh wow, she really does have that. And so I want to compare that to her after picture. Travis, throw up that next one. So you see here in this picture, I mean, she looks a lot different with the hair and the face tattoo and all that, but her eyelids look really, really nice. Like they're nice and smooth. There's no redundancy of the skin. And so, you know,
the bottom, right?
The bottoms, correct.
Yes.
Yeah, the bottom. We were looking at the bottoms. Did you see the bottoms before?
Yeah.
How they had like those lines, or it almost makes you look tired.
Yeah.
So yeah, she really did have a notable amount of lower eyelid skin, and she got a very, very nice result from it. And then I started wondering.
I know 2 guys that have gotten that done.
You do know some people? Yeah.
2, and men. I think men get it a lot, right?
They can, yeah, they do, yeah,
Okay.
for sure. Not all the time, but they do. So I started wondering, for her to have that, because most of the people I do blepharoplasties on are at least like 50, and she's 13 years younger than that. So I actually found a picture of her and her parents. So throw that next picture up, Travis. So you can see in the picture, like both her parents do have redundancy in their eyelids, and that's why she has it so young. Both of her parents have notable amounts of what we call blepharoptosis, which is basically the doctor word for redundancy of eyelid skin. And so, that's how she came to have it at such a young age. So I don't think we've ever talked about eyelid surgery that much, have we?
I think we've talked about it before.
We have done a whole segment on it?
No.
I don't think so.
I think we've just talked about it.
Just like glossed over it. So,
yeah.
So I wanted to spend the rest of the segment just kind of going over blepharoplasty, which is, once again, the word for a eyelid lift. And it is a surgery I do. I don't go out there and push to get blepharoplasties. I mostly do breast and body stuff. But, eyelid surgery is not overly complicated in most cases, so I'm happy to still do them. It can be done on the lower or the upper eyelids. In fact, I do much more upper eyelids than I do lowers.
Yeah, for people who have hooded eyes.
Yes,
Mine
exactly.
are kind of hooded. Mine, I don't know.
I mean, it's not.
There's more people. There's other people with more.
Right, and it can get
yeah.
so redundant that eyelid skin can start to bunch up and then hang over your eyelashes, and it actually can start to decrease your vision.
Yeah, because you're just not opening your eyes as wide, probably. Just
Well, it pushes your eyelids down a little bit, and
Yeah.
also the extra skin actually will come over the eyelash and start to block your peripheral vision, so that your peripheral vision, which should be
getting
pretty
tunnel.
wide, it starts to tunnel both from the sides and the top. And so, yeah, I mean, in fact, when I first started practice, we were doing a fair number of blepharoplasties under insurance, because insurance would sometimes pay to remove that extra skin because it was affecting people's vision. But of course, like everything, it got abused, and so there were plastic surgeons out there doing cosmetic blepharoplasties to make people look more
Yeah.
youthful under insurance. Insurance caught wind of it, and suddenly it got really, really hard to get these covered, to the point that it's almost not feasible to get them covered by insurance anymore, which kind of sucks. So they are a fairly quick procedure. It takes me about 30 minutes per eye to do these. And I said you can do these for both functional or cosmetic reasons, or both. For cosmetics, it's done like Amanda Bynes did to make them look more youthful.
How does she not have visible scars and stuff? How does that
Yeah,
happen?
that's a great question. So
that's on your
when
face.
you do these surgeries, if you're doing them on the bottom, the incision is literally 1 millimeter away from your lash line. So it just blends right in with the kind of edge of your eyelid.
Crazy.
Yeah, and then if you do them on top, you put the incision right in the crease, the natural crease of your eyelid, where it folds when you blink, or when your eyes are open. And so, yeah, blepharoplasty scars across the board should be invisible. I mean, that's the expectation, is that these are.
Do people ever get both up the top?
Sometimes,
and
yeah,
bottom?
you can.
Okay.
Yeah, you can do both. In fact, I was supposed to do a double just recently, a month ago, and then the patient ended up getting COVID or something. I had to reschedule. But yeah, you can absolutely do both. And so what the surgery does is, the main thing that the surgery wants to accomplish is it wants to take out the extra skin. The skin's either the functional problem in that it's blocking their vision, or it's making them look tired. And actually, I have one last picture. Throw that picture up, Travis. This is the pattern that you draw when you're about to take off the excess skin. And that little kind of trapezoidal shaped pattern would be the skin that would be removed. And that pattern is created by basically measuring the number of millimeters away from certain landmarks. So like the corner of the eye, the lash line, your eyebrow, and then also how much skin you could kind of pinch. And so, yeah, you basically, that's half the work, is just drawing the pattern appropriately. And then you excise that piece of skin. There's a little thin layer of muscle underneath that goes as well. The other things that the surgery can do is if people have an excess of fatty tissue that causes their eyelids to be really, really puffy, that's not skin redundancy, then you can change that. That's oftentimes more on the lower than the upper, but it can be it can be both, or a lot of people don't need that. And then lastly, one of the things that an eyelid surgery can do is affect the laxity. So as we get older, and Amanda didn't have this for sure, but as you get older, the lower eyelid starts to kind of hang off the globe of the eyeball, which makes the eyes look a little bit more aged. And so that's the other thing that you can do. So I do these under anesthesia. I mean, it's theoretically possible you could do this under local, but I would never do that. I just don't feel comfortable someone being awake when I have a scalpel and needles around their eye. Like, I want them knocked out.
I wouldn't feel comfortable.
I know people have done these under local, and this is one of those surgeries where it's easy to get the numbing, but it's just the uncomfortable kind of sensation of someone working around your eye. So I really am not into that. As far as the recovery goes, it's really not a painful operation because it's just really taking away skin for the most part. But the problem is that when you operate on the eyelid, it swells. Like, the eyelid does not like to be messed with, and so when you operate on it, it like swells up, which is not a huge problem, except that oftentimes then the eyes won't shut properly, and so you'll end up with like little cracks in your eyelid, which then cause your eyes to dry out. So most of the recovery is just putting eye drops in your eyes and ointment at night to keep your eyes lubricated so you don't get like a corneal scratch from being too dry, and then just waiting for the swelling to go down.
Okay.
So pretty easy recovery outside of the swelling. The instructions are pretty simple. Like, we have people put cool compresses on. We'll have them keep their head up just to keep the swelling down. We'll have them put drops in their eyes. As the scars, which I was going to talk about, you already kind of outlined that the scars really are not visible. Now, right off the bat, they will be. Like, when you do these, obviously the incision is going to be visible in the first few weeks to like a month or so. But really, they do fade away very, very quickly, and they just blend in with the natural creases of the eye to the point that you really shouldn't be able to tell if someone's had a blepharoplasty.
So you're like ready to go for a close-up in like a month or two?
Yeah, probably a couple months. Yeah,
Okay.
Probably a couple months. Complications, overall, very, very low with this surgery. I mean, I've done a ton of blepharoplasties over the year. I don't think I've ever had to take anyone back to surgery for any reason. I mean, as long as you can, know how to draw out the pattern, and keep out of trouble by not banging into like some of the more critical eye structures that are deeper. I mean, these are pretty straightforward to do. You definitely want to make sure that if you're going to have one of these, that you go to a surgeon that's comfortable doing them. You definitely want either a plastic surgeon or oculoplastics or someone in that type of field, because if you get like down too deep or you don't do a clean dissection, you can get scarring, and then the eyelid will scar, and then the eyelid won't seat properly, and you can potentially have some bad complications from these. But in the hands of people who are comfortable doing them, they are pretty smooth.
Yeah.
So
I feel like since your eyes are, one of your five senses, you should be pretty.
You do want to be careful. Yeah, you wouldn't want to like go get this done like in the back alley, like in a van, like discount.
No, down by the river. No.
Yeah, down by the river. So, and talking about cost, like I said, it's hard to get insurance to cover these anymore. It's not impossible, but close to it. If you're going to pay out of pocket, you're probably looking at $4,000 to $5,000, which is maybe a little bit less than a lot of plastic surgeries. Because they're just shorter on time, and there's like no implants or anything. So they're not like too cost prohibitive. But yeah. So I just want to do like a quick 1 minute recap on this. So Travis, come on, zoom in here. We're gonna get real. So Amanda Bynes, 37-year-old actor, went on social media this week to talk about her eyelid surgery. She had a blepharoplasty, which is removal of the eyelid skin. This is a surgery that is pretty simple to do. It's very, very popular, one of the most popular plastic surgeries. Overall has a pretty easy recovery, low complication rate. She did it because she had kind of a genetic predisposition to excess eyelid skin. She got a great result. She's very happy. The cost of this is about $4,000 to $5,000. So that's the recap on Amanda Bynes and her eyelid surgery. So. All right, very good. That was all over the news. I mean, like.
Yeah, I was watching her TikTok on.
Yeah.
I was like, is this real? I clicked on the video, and then I clicked on her little profile, and I was like, is this real? How old is this? Is this recent? And it was a recent one.
Yeah, it was just this week.
She made a new TikTok profile or something. Or deleted all of her old videos or something.
I was wondering that because there wasn't like a ton of videos on there.
Yeah, she's completely
she's
rebranded.
When did she get the face
tattoo? A hard
tattoo?
Rebrand a while ago.
That's what I was thinking. I was like, I may not get the eyelash or the eyelid surgery, but I might get the heart tattue right up.
I think you should, honestly.
I think it'll look kind of dope. Like, I set a trend.
Dude, You know, I mean, I'm all. I'm
Instead
very,
of a teardrop, you're gonna get
a teardrop.
We increase love on this side.
Yeah.
I'm very like open about tattoos. I mean, I have several tattoos. They're just not visible.
tramp stamp.
I don't have a tramp stamp. Do you have a tramp stamp?
I don't.
Okay.
But I saw another TikTok video that those are coming back in style.
Dude, listen. I'm gonna be real with you guys. Like back in the day, I thought they were super sick. Like I really liked them. Like back in the '90s when they were cool.
Well,
Like,
I mean that was like the most popular spot for girls to get them.
yeah, I thought they were really cool. All right,
We should all get Nip Talk tramp stamps.
Oh my
it's
God.
Official. It's official.
But I just want to say, like, that tattoo just doesn't do it for me. Like, it almost looks like it was like a home tattoo.
It does, and it looks really distracting.
It does. Like, you know, I'm not a big fan of face tattoos, except for Mike Tyson. Mike Tyson's face tattoo is dope. Like, that thing looks awesome.
Yeah.
Because it's Mike Tyson, and also it's kind of...
Yeah, there's very few people that can pull off face
yeah.
tattoos.
Like, I don't really like Post Malone's tattoos. Do you know what Post Malone's tattoos say?
On his head? On his forehead?
The eyelid tattoo? Oh, it says, always tired.
Oh.
That was a trivia question.
I do love
today.
Post Malone, though.
Yeah, he's pretty good. So, okay, moving on. So, also talking about recent news articles, there was a new, it was kind of a Gallup study that recently came out this past week, and it was talking about how much worse the overall average American's health is since the...
Is that an AI picture you generated?
It is an AI generated picture. Yeah, that's pretty good. Yeah, you like it?
Yeah.
It's all right. I mean, yeah. Dude, you know that ChatGPT can create images now.
Yeah,
It's
I've
pretty
used
great.
it.
Have you been using it?
I tried to.
Yeah, it's pretty neat. Yeah, I've been making some fun images. Anyway, so sorry to derail us, but anyway, so Gallup did a study recently that was looking at certain metrics of health, and they looked at it at 2019, so right before the pandemic, and they looked at it today.
What's Gallup?
So Gallup's like a big polling service.
Oh, okay.
Like they do like these massive study polls that, like this one, I think it had like 10,000 people in it. It was
Is it like scientific or like educational or like a .org or a .edu thing?
like Gallup, like they're just a polling service. They do polls, they release data.
Like for whatever.
Yeah, like for whatever.
Oh,
like
okay.
they're really popular. Like them, and then the other big one is, oh man, it'll come to me. There's like a few really big like polling services that reach out and get data on various topics.
Oh, okay.
So this wasn't like a research study, so to speak, like a university. This was like a Gallup study,
Okay.
which still it gives you good information. Like most of Gallup stuff is at least reasonable. You know, like it's not like bad information. But so they looked at like 2019 versus today on several different metrics. They were looking at obesity, diabetes, exercise habits, and dietary habits.
Okay.
And they wanted to compare because, you know, you always, I guess I had always heard this, maybe tell me if you had, that like we are not quite as healthy anymore as we were pre-pandemic. Have you heard that?
Yeah, just from not being able to like get around, not having
definitely
social.
Right, definitely multifactorial, I think. But, you know, I just had heard, you know, in various places that, you know, everyone's health is in the crapper after the pandemic. And so it was interesting to kind of see some data on this. So the first one was obesity, all right? So they looked at the percentage of people who qualified as obese in 2019, which, all right, do you know what the percentage is in the United States? I hate putting you on the spot.
Is it over half? I'm guessing. No.
No, not quite that high. So in 2019, it was 32.4.
Oh.
Yeah, it's about a third.
I
Third
said
of the population.
30,
So 32.4. So today, the percentage of people who reach the criteria for obesity is 38.4. So that is a difference of 6%, which is a change of almost 20%, meaning 20% more people are obese today of the obese people. Well, it went up by 20%. Yeah.
Okay.
6% are more obese, but the percentage change is 20.
Okay.
That's a pretty big number. Like that's a big jump.
Mm-hmm.
So that was pretty notable. The other thing that also was a metric is diabetes. Now that also goes along with, you know, being overweight or, you know, having a bad diet. So in 2019, the percentage of people that had diabetes was 12.5%. Today it's 13.6%. So that's definitely gone up. The age bracket that got hit the worst is kind of all of our age bracket. I'm including myself, even though you guys are younger than me, because it was the 30 to like 60 bracket.
Okay.
So just to kind of know who's most at risk. And so the two factors that often contribute to obesity and diabetes are the other two factors they looked at, which is nutrition and exercise, right? So with exercise, I'll start with exercise. I would kind of assume that people got out of the habit of exercising and that number was going to be down, but that actually was not true. It actually remained steady with really no change in the amount of people who exercised regularly during the week. So that was good. But what really went down was eating habits.
Yeah.
I don't know what it was about the pandemic, but we started eating like crap once the pandemic kind of hit. So the percentage of people who reported eating healthy in 2019 was 51.7%. That's pretty good. I would consider myself in that. I feel like I eat pretty healthy, so I would say, yeah.
I think I have a reason for why people were eating so unhealthy.
What do you think it is?
It's because they were so unhappy.
I mean, that probably has something to do with it, for sure. I would agree with that.
Because I know that sometimes, like, whenever I'm, like, sad or, like, depressed, I'm like...
Right, you're doing comfort foods.
Yeah, like, I want to eat, like, a pizza and have, like, a milkshake. So, like, you can get, like, that immediate happiness. Yeah. And so people are just sitting at home by themselves, and they're like, I need to be entertained. And I know the best way to get entertained is to eat some good food.
Yeah, I think you're probably, I think it's multifactorial, but yes, you're absolutely right that people's kind of overall mood. So yeah, 2019, 51.7% reported eating healthy. Today, it's 46%. That's a pretty big drop. The number of people that eat fruits and vegetables in 2019 was right at 50%. Today, it's 42%.
Yikes.
That's a big, these are really, really big numbers. Also, they looked at one last thing, which is the number of people who had high cholesterol. 2019, 21%. Today, 25%. That's a big 4% jump. So, it's just kind of interesting to actually see some numbers on this data because, like I said, I'd always heard that the health overall was not as good since the pandemic. I hadn't seen any kind of, really kind of good information on that, but these numbers are a little bit concerning. And so, what does that mean? Well, we just kind of need to get back into the swing of being healthy because, these things that are going up like obesity and diabetes, they directly affect your lifespan and also your quality of life. Mm-hmm. And those kind of things creep up on you, it's like during the pandemic, this happened to me. We weren't going out and doing very much and, I was eating not as good and I noticed I was not as fit.
People are satisfied with sitting on the couch.
Yeah.
Instead of getting dressed, getting ready, going somewhere.
Right, and if you're not going out, then why, you kind of let yourself go a little bit. It's like, oh, well, I'm not going out. I don't need to go work out. What's the point?
I don't need to fit into this outfit anymore.
Yeah, right. I do think that you're on the mark though as far as
depression and stuff.
Yeah, depression and just changes in how people's day-to-day social life was altered by the pandemic. It's kind of interesting to see that.
I wonder, when they do this poll again, how much that semaglutide is going to affect.
Because it's really popular.
So people are more unhealthy and obese, and then semaglutide is just up.
Thanks, semaglutide, getting us back on track.
Yeah, and I'm like, was this all planned to
Right, was the pandemic planned by the semaglutide people?
Yeah.
Maybe.
Yeah.
Yeah, I don't know. It'll be interesting to see how long it takes us to kind of get back to that 2019 baseline. I liked America when we were all out there, trying to look good and be healthy. Not that I run around judging people, but just in general, you want people to be healthy.
You do run around though.
I do run around. I don't usually judge people, but
no judging.
There's no judge here, but I do run around. It'll be interesting to see how long it takes us to kind of get back to those pre-pandemic levels. Mm-hmm. And now we got some data, so I don't know. I'm thinking. You still hear about the pandemic though. It's like it just won't die.
One of my friends, very close friends. She was supposed to come with me to go see the Harry Potter thing.
Yeah.
And she called me. She's like, I have COVID.
Really?
Was she
sick?
Yeah.
Really sick or?
Yeah, she said she had gotten, a little fever. And she said, my chest is hurting. And she goes, this reminds me of whenever I got COVID a year ago. Mm-hmm. But she never got vaccinated.
She didn't? Did you ever get COVID? Mm-mm. You never got it?
Me and Avery never got it.
Wow. I finally got it a year and 3 or 4 months ago.
Yeah,
it was
I only got the 2 shots. And Avery never got
vaccinated. I got 2 shots and a booster, I think, yeah. I haven't got the last one. I don't know. When the pandemic kind of winded down, I was like, maybe I'm not going to get the next one. But I may still get it. I don't know. Honestly, I'm just running around so busy, I just haven't thought about it.
I don't know why me and Avery never got it. I don't travel that much, but her dad travels
That's amazing
a lot,
that you haven't got it. Like, Travis, did you get COVID at some point?
I did.
Did you?
Yeah. I did in February.
Did you get sick or not really?
Yeah, no, I got really bad sick.
Did you really?
And then like my back like hurt really bad and my kidneys hurt. Like
really? Wow, you got sick.
Did you go to the doctor? Like, did you go to the hospital or anything?
No, I did not. I kind of like just quarantined at the house.
Yeah. When I got it, I was sick for like 20. And when I say sick, I had like fever and cough for 24 hours, and it was done. It was crazy. But I was vaccinated, so like.
You were able to like.
Yeah, my body's like, I recognize this, and it just like kind of took care of it, and I was fine. I had a week off work, and I wasn't even sick because
maybe me and Avery did get it one time.
You may have, because a lot of people really were getting some asymptomatic, especially young healthy people were getting asymptomatic cases. So, but. Yeah, interesting stuff. So, pandemic's still screwing up our lives now 4 or 5 years later. Thanks, pandemic. Yeah, thank you. All right, but Sarah is going to tell us how we can get back into good health.
Yeah.
And I'm really interested in this topic, and I don't want to steal your thunder, so Sarah, take it away.
So let me get my notes. So I'm going to talk to you all about running versus incline walking.
Right.
And whenever I was doing my research, I made sure to find things that were saying for fat loss, not for weight loss. It's the same thing, but like some people, some people, I guess I need the clarification, because whenever I think weight loss, I think all in general.
Right, you're trying to
muscle,
trying to trim down,
but fit. Some people are like, I want to lose fat and gain muscle. So fat loss is their main.
So this is not for gaining muscle, or is it?
It is.
Oh,
it can be.
Okay.
I'll show you, tell you. But that's what I researched when I was doing this. I tried to find an article that specifically talked about fat loss, not just weight loss. Because obviously, when you're talking about running versus walking, you lose more calories running.
Right, you burn more.
Bottom line, yeah.
You burn more.
So you burn more calories, therefore you will probably lose more weight.
Gotcha.
But
this is a little bit different.
Yes, this is a little bit different.
Okay, I'm ready to learn.
Okay, so I got my stuff. I have a little picture. Did you put it up? That's my picture.
I like it.
Is that somebody you know?
No, that's from the article. Okay. I'm like, that's my new boyfriend.
Hey, what's up?
In a random alley. Sketchy. No, so this is from fitandwell.com. Okay, so running and incline walking both help increase your heart rate.
Sure, that's good.
Obviously.
Yeah, that's good. Get your heart rate up.
Vital part of your health, helps burn energy, boost your metabolism, and just basically essential for a long, sustainable life. Running and walking.
Right. Now, when they say incline walking, is there a certain grade that they're talking about?
Yeah, I'll tell you.
Okay, now if you're going to say it, you don't have to jump ahead.
Okay, cool.
I was just curious.
Yeah, no, I'm going to talk about it.
Okay. Excellent.
So just like baseline, why would you think walking is better for, like, what is it better for?
Well, the one thing I would say about walking versus running is hard on your joints. Yeah. And so you're more prone to have injury. I mean, I'm constantly having to, like, as a runner, like stretch before, stretch after, I use like heat, but yeah, like my joints are just like, what are you doing here? This is not normal.
Yeah, so basic walking is better for your joints and for fat loss beginners. Okay. So that's being like somebody who does not exercise regularly.
Right, because they're not going to get out there and run. Probably, right?
Well, if they ran, they wouldn't be able to do it for a very long time, which would negate what it's really for.
Right. They would burn more calories while they were doing it, but they wouldn't be able to do it for long enough.
Yeah, so they wouldn't be able to do it consistently. And then running, obviously. Running is better option for people who are...
athletes?
Yeah, already fit and maintaining.
Sustained.
Yeah. So... depending on your speed, walking on an incline can often be as effective as running on a flat surface.
Right, that would make sense because I can tell you for fact that running up a hill sucks big time. Even a small grade can just crush you.
It does, for sure. So for every incline gradient on a treadmill, your body has to expend...
Is that like each percent grade? Okay.
So your body has to expend, on average, 4% more energy, boosting the calorie burn significantly.
So like a 10% grade would be a 40% increase.
I guess. You're the math person. I don't know nothing about no math.
I don't know nothing about no numbers.
No, sir. But yeah, so.
But yeah, that'd be right. I mean, a 10% grade, which is not a huge grade, would actually burn quite a significant amount of calories.
Yeah, and after I did all this research, I got so many ads for these TikTok shop things where it's a little treadmill thing for walking, and you can make it, and you can put it at your desk, and you can make it go at an incline.
It's like a.
It's not like a regular treadmill where you have like, the arms and stuff, and you can do all the who's out there.
Yeah.
It's literally just a flat thing, conveyor belt looking thing, and you can raise it up and down, and you can just walk at your desk.
Walk on it. So
like
you
standing up,
power
walking.
it, doesn't have a motor?
I don't know.
Probably not. You probably power it. Yeah.
Yeah, I don't know.
Interesting. Okay, did you
I
buy
got
one?
so many ads for it. I thought about it. I saw it more than 9 times, so it's been in my head for a while.
Christmas is coming up, Sarah.
I buy myself that, yeah. So cute. Okay, so how would you lose fat from running and walking? So a fast-paced walk or a walk on an incline will place your heart into a heart rate zone where your body can utilize fats for energy most efficiently.
Is there like a certain heart rate goal, did it say?
No,
It didn't
but
say that.
that would be probably
I would say
beneficial
what, like
to know.
100, 120 maybe? I mean, over 100?
I don't know. That's
Yeah.
a good, we can ask
follow-up
Siri
question.
after this.
Ask
So this is because most people can walk longer and consistently than running. So I think of it as
That makes total sense.
I think of it when you have when you're walking and you're doing it for a long period of time, you need endurance fuel.
Right.
And it allows you to use that fat storage, which is your endurance.
Yeah, because
fuel.
normally, and I'm going to pull out some doctor stuff here,
Yeah.
normally you burn glycogen from your liver for energy, but I guess if you go hard enough, then you start to break down that fat for energy.
Yeah, and that's the endurance fuel. That's the part where you just like keep going even when you don't want to go anymore. So running at a moderate pace is also great for burning calories. However, the body would be using more carbs and fat, but more carbs as fuel source. This is because of a more immediate need for fuel. Your body will use fast energy, like not stored fat, but it'll use carbs when in need of fuel. So you can think of when you're running, you're using your fast fuel.
Right.
And whenever you're walking for those long periods of times, like an incline, which is best if you want to lose fat, you're using your endurance fuel, which is
fat.
like, your backup.
Oh, that makes sense. Okay.
Because your body's like, when you run, your body's like, oh my gosh, we need to run. It's like your animal instinct. Your animal instinct kicks in. They're like, you need to use what you just ate.
Yeah.
What we're still processing.
Right.
Yeah.
Okay.
Yeah, so that part made a lot of sense.
That
to me
does
when I
make
was reading.
perfect sense, actually. And I'd never actually thought about that because obviously I'm going to be like, oh yeah, running's way better than walking. But,
it is to a certain extent.
It is, but like the walking, like that whole thing about the endurance and burning fat versus glycogen or glucose, like that makes really good sense.
Yeah. So now so how do you think you could gain muscle while running and walking?
So I used to run with a weight vest. In fact, I
Definitely.
still have it. And boy, let me tell you, running with a weight vest is a workout.
I've done it, but I don't like to do
Even walking
it.
with a weight vest.
Yeah.
I got up to where I was running with an extra 10 pounds, which you'd think, 10 pounds is nothing.
It's horrible.
It's a lot. Like,
Yeah.
When you go from like having nothing to putting on a weight vest, oh my gosh.
And then you take it off, you probably feel like you're
I know.
going to fly away.
I'm the Flash.
Yeah, CrossFit people are always putting on weight vests. I'm like, no, not
I
me
have a
today.
good one somewhere. I liked it. When I was, this is like many years ago, like maybe 10 years ago, I was running with weight vests.
Nice.
It's like legit. I may bring it back out.
I need to probably do it. I should walk with one on. But
walk.
So for you to gain muscle while you're walking, the best way is to do a low gradient or fast walk would be, the best way to gain that muscle is to do at a steep gradient, low speed.
Okay.
And then
that almost makes sense. It's almost like weightlifting where you do like
that
heavy
puts your
weight,
body
low
into
rep.
a strength training
Yeah.
type vibe. And then obviously low gradient fast walk is more of cardio based.
Got it. That makes sense.
Yeah, and then running, if you sprinted, and then slow down, like you sprint as fast as you can, slow down
done
or
that.
walk, that is going to be your best form of, without using weights and all that kind of stuff, that's going to be your best form of strength training,
Muscle build,
gaining
yeah.
muscle. And then obviously, high and just running normal.
I used to do those
Yeah.
workouts where you like run as fast as you can for 30 seconds or a minute, and then you walk for 5 minutes, and you repeat that, and you do that, I don't know, 3 or 4 times down the road, and then you come back.
Yeah, it's really good for strength training.
Yeah.
So, so all in all, it really depends on your preference and what your goals are.
Right.
When you're thinking about running and walking. So personally, I am not a runner.
Yeah.
I can't maintain a good pace when I run. So like when I run, I usually only run a mile, and running a mile is not going to really do that much for me, except like maybe burn the calories I drank of a Dr. Pepper. That's it.
Right. I mean, a really, 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 really rough estimate
Yeah.
is that like running a mile is like burning 100 calories. Now,
Yeah.
calorie burn depends on your weight and your speed in addition to the distance. So there's a lot of like factors that go into that, but just very, very generically, like a mile is roughly 100.
Yeah, so like I know that if I ran a mile, that would take more out of me. Like it would make me more tired than just walking for 30 minutes.
Yeah.
Yeah, it would.
Yeah, because you could probably walk 2 miles in 30 minutes.
Yeah, I don't know. But I know, just because I know like how my body is, like whenever I run a mile
You're
for
not
like
like an endurance
CrossFit,
person.
no, I hate
Yeah.
doing that stuff.
That's I got
So at my house, I live in my neighborhood. I have like a really cool neighborhood where it's like all windy and hilly.
Oh,
so I can run
I'm gonna come
and
run at your
walk.
house.
Yeah, it's really pretty. When I can run and walk in my neighborhood, and there's hills and
Oh, that's
inclines I
perfect.
can go on. So that's what I like to do. I don't like to run like straight. I
Yeah.
can't do it. But that's a good way to build muscle, doing
Gotcha.
that, doing the sprint and walking, just keeping that pace of where you can still talk and
Right, right.
being, yeah. But for you, I know that you like to run and
I do like to
stuff.
run, yeah.
But if you incorporated some incline walking or sprinting, that would make your
Yeah.
muscles, you'd have some good,
I may go back to doing that sprint, like sprint for 30 seconds to a minute, and then 5-minute cool down, and repeat that, and do it, 8 or 10 times.
yeah. I would be
that'd be pretty
interested to see how it would improve your time.
Well, yeah, I mean, well, back in the day, I was really, really, really into track. Like,
So you did that stuff all the time?
Yeah, oh yeah, I did all. We would do these crazy things like with strength shoes and parachutes and like running against, some resistance. I mean, yeah, we did like literally everything
Yeah.
back when I was really serious about this stuff.
Yeah. I think that the sprint and the walk.
Yeah, I may do that because you can do that in your neighborhood. That's easy to do.
That's the great thing about running
Yeah.
and walking.
Yeah, you can do it almost anywhere.
It's free.
Yeah, and I have the best road. Like my road is exactly 2 miles long.
Yeah.
So if I run to the end of it and come back, it's 4 miles, and it's pretty straight. And the only thing is we got more traffic out there than we used to, but
Yeah.
so you get to dodge cars. How many calories is dodging cars?
I don't know.
It's got to be a little bit extra.
Yeah. I mean, it definitely is going to raise your heart rate
Yeah, sure.
out of fear
Right.
of death. But yeah. So either way you slice it,
So-
fat loss, you can get it from a calorie deficit through nutrition and exercise.
Yeah.
Bottom line.
Yeah.
So.
I think that honestly, the most important thing I learned from this was just the fact that when you're doing that running incline or walking incline, that your body predilects to burn fat over glucose or glycogen, which is more from running. I mean, that makes sense, and you can lose fat from running, but it's almost like the walking incline is just really made for it.
There's like definitely a
And
part.
anyone can do that.
Yeah.
Anyone can do it. Like, it's hard to go out and run 4 miles for most people, but anyone
Yeah.
can do incline walking.
Yep.
Yeah. So I'm gonna have to give the nod to incline walking between those two.
Yeah.
Even though I love to run.
Yeah.
Just because I think more people could do it.
The reason why I like the walking thing is because, and the incline is because it is it has been shown to gain muscle because of the
Yeah.
strength training
Right.
part of it.
The strength,
So in
yeah.
my mind, I'm thinking, so if I'm gaining muscle, I'm probably losing fat.
Yeah, for sure.
So it's like, that's what makes
Yeah.
that's why strength training is so beneficial.
Yeah.
So, yeah.
Which I need to get back into that. But
Yeah.
so many hours in a day.
Lift those weights. Yeah.
It was so forceful. Lift those weights.
Get 'em.
America. Okay. But
All
that's
right.
it. The end.
That was good. Like, I actually really enjoyed that. I at first I was like, oh, running versus running, but it's like so much more deeper than that. And
Yeah.
there's so many different kind of factors that weigh into what would be best for different people. So that was really good, Sarah. Thank you.
You're
I'm
welcome.
gonna give you a clap.
Thanks.
Good job, Sarah. All right, I think that is all the time we have today.
Yeah.
But come back next week. We'll be right here talking about some different topics. Please leave us a comment and let us know what you want us to talk about it, and we'll talk about it here on Nip Talk. See ya.
Bye.